you're training now. How much you got? 14. How much coming from town? 4. Which is 18. Now it's 24.
I'm here in Mavaruma, and this is region 1 of Guyana, and we are here on the cervical cancer prevention campaign. This river and the boats around here brings hundreds of people here every day, and they have a small hospital. But the irony is that cervical cancer is at its peak over here. And we are here with our team from Cancer Institute of Guyana, screening the women with pap smears and also seeing other medical problems in the communities.
Even if it's for the cough and cold, at least you can see the doctor because we know the distance is quite far from Mavaruma, right? Yeah. So the purpose of coming here is to give aid to those who can't make it till now.
There's a strong incidence of cervical cancer in this region, and we have especially been asked to come here, region 1 and region 10, to take care of the people, okay? So you have this facility. You can save your sisters, daughters, friends by bringing them here. If we recognize something in you, it is easy to treat. So what we are trying to tell you is to look after yourself, get a screen, tell your people out there, and get advantage of this visit. So we are going home to home, letting people know what we are doing here. This is a campaign against cervical cancer especially. So Dr. Cox is with me, and we're trying to find the absconders.
Okay. So we came out of Whitewater today to pay attention to the women in Whitewater mostly, right? Because we're concerned about women's health. So we're doing a number of tests at the health center, right, for women, and we brought some medication, not much. But we come to screen women, check to see if everything is okay with them, right? Because if everything is not okay, we want to attend to it early. There might be a time when you really need it and you can't get it because you live so far, right? So I would advise you all to come down right now, right?
So if you want to be afraid, you can be afraid of anything here. Insect bites, mosquito bites, snake bites, anything. But what gives one courage is that you are doing something. Something for the humanity, something for the people over here, and that is enough to save you from everything. You do it.
Yeah. Alright. Get up. You can sit, Dr. Gazi, and we are Dr. Zain, and we come to check all the women in Whitewater, right? So when class is over and you go home, you want you to tell your mother, your sister, your grandmother to come down to the hospital, right? So that we can check them. Let them come before 4:30 to the hospital, right? Okay. So we can check them because we're going back to the, you understand? Wonderful.
We need to know, we need to see if they're all right, okay? Your mom, your grandmother, right? If you love them, you will tell them. Wonderful. We are waiting there.
Right? You have a lot of people you bring out here. Is who your mommy? Yeah.
Good afternoon. He's bringing you here, right? Good. You brought your mother? Good. Wow. It worked. It worked, man.
Right? So you want to be brave?
It was very thoughtful of you all to come and visit us. It is very good for the young ladies, especially teenagers.
Screening for the women because we're looking for early signs of cancer. Right? So we just check in all those above 16. We want them to come so we can check them because we're promoting women's health. Right? And so we got all of this is free.
And save the life. In Cancer Institute in Georgetown, we get women from your area, from all other areas in very advanced cancer. Okay? Then we can save them. So we come here in your area and other areas to save those women before they go to that advanced stage.
Helpful. Yes, because we live so far and if we get sick, we don't know what to do, and I want to tell them that we have to take care of ourselves. Come to the health center, to the doctor, the health worker to seek medical attendance.
Tested is good?
Yes.
How?
Yes, I feel the testing is good because I get so much of children.
Okay.
And I want to see if anything is wrong to my womb inside.
We're here today because the prevalence of cervical cancer in women is increasing. Not much emphasis is being placed on the actual screening process.
And when they come really lower back pain, lot of symptoms, when I explain you about it all in detail. So they reach stage 3, stage 4, last stage, and then the chances of cure or survival is reduced, like 2 to 3 years, like here. Not cure, but this is the type of care.
Well, I feel it's important for every woman to have themselves checked regularly to be sure that you don't have any cancer or anything.
Samples taken off today here at Mackenzie Hospital, and tomorrow we're going to have the training session and a presentation done by Dr. Ghazi, and then you will have an opportunity now to see how the
It's very important. Let me start off by saying it's very important that if you have the opportunity to have a pap smear done, and not more so an opportunity, but it's a necessity to have it done once you're sexually active. But we have seen cases where they have patients who are younger, even in the teens, with cervical cancer. So the thing is, once you are sexually active, right, you should come and have it done, because prevention is always better than cure.
Now, out of this grant, Guyana had opted to look at 2 regions. We had region 1 where we went to Mabruma, and we went to 3 areas within Mabruma. we have successfully completed at least 67 pap smears in 2 days.
As I'm a midwife, today's presentation enriched my knowledge about cervical cancer, and I'm better knowledgeable to give persons in the community more share my knowledge.
I think it has to do with you making up your mind. Because before I was pretty scared, but for some reason this morning after I heard it on the radio, it just happened. So I know died with cancer, and I had a friend who had cancer. She had radiation, and now I see she hair grow back and she looking pushy back again. So I come check myself to see what's happening with me.
It wasn't such a bad experience. I mean, some people, it was something that you kind of were scared to do because they all thought of it. But it wasn't that bad. It was actually good. And you feel much more relieved because it's a sort of, you get it off your mind because you keep thinking, it's something I need to do. I know at least for me, it was something I keep thinking I need to do because, Crystal, you need to get this done. Make sure that you're okay. Make sure that you're safe. And don't wait until it's too late. So I feel very satisfied that I had it.
Every woman should come and know their status. Just like how everybody wants to know if they're HIV positive or not, you should know if you have cancer because cancer is a chronic illness. And it's better to pick it up early than to wait when it's too late and the doctors can't help you.
Pap smear gives you an advanced idea to know what is going on with your body and your womb especially.